Erectile dysfunction is the inability to get and keep an erection firm enough for sex. Having erection trouble from time to time isn't necessarily a cause for concern. If erectile dysfunction is an ongoing issue, however, it can cause stress, affect your self-confidence, and contribute to relationship problems. Problems getting or keeping an erection can also be a sign of an underlying health condition that needs treatment and a risk factor for heart disease. If you are concerned about your erectile dysfunction, talk to your doctor even if you are embarrassed. Sometimes, treating an underlying health condition is enough to reverse erectile dysfunction. In other cases, medications or other direct treatments might be needed. Symptoms. Erectile dysfunction symptoms might include persistent trouble getting an erection, trouble keeping an erection, and reduced sexual desire. When to see a doctor. A family doctor is a good place to start when you have erectile problems. See your doctor if you have concerns about your erections or you are experiencing other sexual problems such as premature or delayed ejaculation. If you have diabetes, heart disease, or any other known health condition that might be linked to erectile dysfunction, and if you have other symptoms along with erectile dysfunction. The causes of erectile dysfunction. Male sexual arousal is a complex process that involves the brain, hormones, emotions, nerves, muscles, and blood vessels. Erectile dysfunction can result from a problem with any of these. Likewise, stress and mental health concerns can cause or worsen erectile dysfunction. Sometimes, a combination of physical and psychological issues causes erectile dysfunction. For instance, a minor physical condition that slows your sexual arousal might cause an anxiety about maintaining an erection. The resulting anxiety can lead to or worsen erectile dysfunction. Physical causes of erectile dysfunction. In many cases, erectile dysfunction is caused by something physical. Common causes include heart disease, clogged blood vessels, high blood cholesterol, high blood pressure, diabetes, obesity, metabolic syndrome, a condition involving increased blood pressure, high insulin levels, body fat around the waist, and high cholesterol, Parkinson's disease, multiple sclerosis, certain prescription medications, tobacco use, development of scar tissue inside the penis, alcoholism and other forms of substance abuse, sleep disorders, treatment for prostate cancer and enlarged prostate, surgeries or injuries that affect the pelvic area or spinal cord, and low testosterone. Psychological causes of erectile dysfunction. The brain plays key role in triggering the series of physical events that cause an erection, starting with feelings of sexual excitement, a number of things that can interfere with sexual feelings and cause or worsen erectile dysfunction. These include depression, anxiety, or other mental health conditions, stress, and relationship problems due to stress, poor communication, or other concerns. The risk factors. As you get older, erections might take longer to develop and might not be as firm. You might need more direct touch to your penis to get and keep an erection. Various risk factors can contribute to erectile dysfunction, including 1. Medical conditions, particularly diabetes or heart conditions. 2. Tobacco use, which restricts blood flow to veins and arteries, can over time cause chronic health conditions that lead to erectile dysfunction. 3. Being overweight, especially if you are obese. 4. Certain medical treatments such as prostate surgery or radiation treatment for cancer. 5. Injuries, particularly if they damage the nerves or arteries that control erections. 6. Medications including antidepressants, antihistamines, and medications that treat high blood pressure, pain, or prostate conditions. 7. Psychological conditions such as stress, anxiety, or depression. And lastly, drug and alcohol use, especially if you are a long-term drug user or heavy drinker. The complications of erectile dysfunction. Complications resulting from erectile dysfunction can include an unsatisfactory sex life, stress or anxiety, embarrassment or low self-esteem, relationship problems, and the inability to get your partner pregnant. Diagnosis: For many people, a physical exam and answering questions are all that's needed for a doctor to diagnose erectile dysfunction and recommend a treatment. If you have chronic health conditions or your doctor suspects that underlying condition might be involved, you might need further tests or a consultation with a specialist. Tests for underlying health conditions might include 1. Physical exam. This might include careful examination of your penis and testicles and checking your nerves for sensation. 2. Blood tests. A sample of your blood might be sent to the lab to check for signs of heart disease, diabetes, low testosterone levels, and other health conditions. 3. Urine tests. Like blood tests, urine tests are used to check for signs of diabetes and other underlying health conditions. 4. Ultrasound. This test is usually performed by a specialist in an office. It involves using a wand-like device held over the blood vessels that supply the penis. It creates a video image to let your doctor see if you have blood flow problems. This test is sometimes done in combination with an injection of medications into the penis to stimulate blood flow and produce an erection. 5. Psychological exam. Your doctor might ask questions to screen for depression and other possible psychological causes of erectile dysfunction. The treatment. The first thing your doctor will do is to make sure you are getting the right treatment for any health condition that could be causing or worsening your erectile dysfunction. Depending on the cause and severity of your erectile dysfunction and any underlying health conditions, you might have various treatment options. Your doctor can explain the risk and benefit of each treatment and will consider your preferences. Your partner's preferences might also play a role in your treatment choices. Now, to the most important part of this video, the prevention. The best way to prevent erectile dysfunction is to make healthy lifestyle choices and to manage any existing health conditions. For example, work with your doctor to manage diabetes, heart disease, or other chronic health conditions. See your doctor for regular checkup and medical screening tests. Stop smoking, limit or avoid alcohol, and don't use illegal drugs. Exercise regularly. Take steps to reduce stress and get help for anxiety, depression, or other mental health concerns. Thank you for being with me to the end of this video. Like, drop your questions and concerns in the comment section. Share this video to your family and friends if you find it informative, and kindly subscribe to my channel if you haven't. Till we meet again, take a very good care of yourself. Remember, you can also make a difference, and don't forget, Kofi loves you. Peace out.